Welcome to this mini lecture of the Resemble project, which is about e-health and virtual coaching for chronic lung conditions. And in this mini lecture, I would like to provide to you a short introduction into e-health and coaching, and also provide you with some examples of coaching for people with chronic lung conditions from our own research and experience in collaboration with our local care organizations. So let's start from the beginning. And that is, why do we need e-health? And actually this picture shows the pressing healthcare challenge that we are facing. We see a number of older people. They are actually getting older, and they also have an increasing number of chronic conditions, which we of course cannot see on this picture. But what we can see is that they are all sitting, they have a more inactive lifestyle, and they need some supporting aids for their health. On the other hand, we do not see young people on this picture that can now provide this care. And that is an issue, because we know that for the treatment of chronic conditions, we need to focus on prevention, on lifestyle, and on long-term care, because the chronic conditions are all linked by common and preventable risk factors like high blood pressure, but also related major behavioral risk factors like an unhealthy diet, physical inactivity, or tobacco use. So it requires a lot of coaching and intense contact with a healthcare professional to really guide the patient in changing lifestyle and to provide long-term care and enable self-management. So we have a huge challenge that we are facing. We are in need of high quality, affordable, efficient and available healthcare. And specifically, we need care at the right time and the right place. And that means that we need to transition the care from the institutions and hospitals towards primary care and especially towards the daily environment. Also, we need to focus more on prevention and lifestyle, like early diagnostics, self-management and patient empowerment. And how can we do this? Can we do this by technological developments? Well, one of those technological developments is eHealth. And there are many definitions of eHealth available, but it is sometimes defined as eHealth is the application of digital information and communication to improve or support health and healthcare. And this means that where now coaching for example, a healthy lifestyle is done by humans or healthcare professionals, it is now transferred into coaching by technology. So I would like to show you an example of an eHealth application, in this case for pediatric asthma. And for children with asthma, it's really important that they keep their asthma under control. What we now see is that the child visits the hospital once or twice a year when they have an appointment or scheduled appointment with their healthcare professional. In the meantime, they are admitted sometimes to the hospital because they have flare-up of their symptoms. So can we not make sure that actually the child goes to the hospital when it's needed, so that we can provide care at the right moment and in the right place? Also, we know that in case of asthma, a healthy lifestyle is really important, not only as a treatment to keep the asthma under control, but also to monitor as behavior for diagnostics. But we did not know yet what we should monitor. So we did a study with several types of wearable sensors to gain insight in the asthma control of a child with asthma. So we measured activity, sleep, the EKG, we used smart inhalers and spirometry. We used and transferred this monitoring via digital app in which they also could have video and communication with their health professional from home. From the study that we did, we saw that 100% of the uncontrolled asthma could correctly be identified by the model from home, so by using the wearable data. When we applied this eHealth application, so the monitoring, but also the digital application, and that we timely adapted the care based on the data, we saw that in a 6-month study, 80% gross reduction was found in healthcare utilization, a 25% increase in the self-management level, and a 20% improved therapy adherence. This is very nice, but moreover, it's really nice that actually the patients and the healthcare professionals and the parents really liked this type of care, and that it was suitable for care at a distance during COVID. And that requires some new types of interaction. So now a patient goes to his physician and has contact about his lifestyle and his treatment. Suddenly, there's now the technology factor added. So for example, the patient wears a smartwatch to monitor some symptoms in daily life. This also means that this can support the self-management of the patient because the patient can actually see how he is doing. Also, it can support, on the other hand, the healthcare professional because there's more insight in the data from daily life, and this can be used for clinical decision making. So there is now a new triangle between the patient, the healthcare professional, and the technology that can facilitate shared decision support or shared decision making and tailored coaching. So what is this coaching exactly? Coaching is to teach or provide instructions or advice to support an intervention or to establish an intervention or behavioral goals. Coaching is also different than feedback, where feedback is actually to inform about a past or a present event. It's also an instrument for coaching. So coaching can be seen as feedback plus the strategies that you need to achieve certain goals or certain behavior. So coaching is focused on future behavior, something that you would like to achieve. On the performance, it's developmental and there's not necessarily input required. You can receive some general advices, for example, to stop smoking. On the other hand, feedback is focused on your previous behavior or your present behavior. It's focused on the results, it's more evaluative, and there's always input required. As said, the coaching consists of feedback plus the strategies to achieve a certain behavior. And we know from literature and several studies that interventions that are based on theory, like behavior change theories, are more effective. These behavior change theories explain the behavior of, for example, physical activity, and they can help to guide behavior change. They can also be used for tailoring the feedback that you provide to a patient using an eHealth system. Tailoring is important because every individual dealing with a condition like COPD presents a distinctly unique case, and that highlights the need for tailored care. So what you can see in this picture, which is a very old picture of Xerox, you understand that we cannot make the same suit for each individual person because for some people it fits perfectly, but for other people it is too large or too small. And the same accounts for healthcare and for coaching. Furthermore, we know that compared to non-tailored interventions, tailored interventions are more effective and also have higher adherence rates. So how can we actually make such an eHealth system that has coaching as an output? In this overview, you can see all the elements that are needed to make such a personalized or tailored coaching. So first of all, you have the monitor building block. So a patient monitors certain physiological signals using wearable sensors, but also data from the phone or experience sampling or the surroundings are measured. Then this data is used for analysis and interpretation of the data. So what does it actually mean that we are gathering this data? What kind of things does it say about, for example, the progression of a disease? Then the third one is the reasoning and the decision making. So if we understand what we actually measure, what will we do with that? What kind of decisions or clinical decisions can be made based on the data that we gathered, combined with, for example, other knowledge like health guidelines. And then fourthly, we have the feedback and coaching, and that can be offered in different ways. So what we know, for example, are text messages, which are used many times, but also there are gamification elements that we can see in eHealth applications, even holograms or avatars or virtual coaches. So I'd like to show you an example, which is the activity coach. The activity coach has been developed at Roesing Research and Development already quite some time ago, and it consists of an activity sensor connected to a mobile phone. The activity sensors measured the daily activity behavior of a patient at home and in daily life, and it's shown on the screen of the mobile phone. So the blue line that you can see in the graph is the measured activity, and the green line is actually the activity that the person should aim for. It's the goal activity. Furthermore, the patient receives feedback messages to help to achieve the behavior. So he receives an advice that says what the current behavior was and a specific tip how to improve the current behavior. Several studies have been performed with this activity coach and also for patients with COPD. And we see also from these studies that people actually listen to these type of messages. So people increase their physical activity behavior when such messages are provided, and they also decrease their physical activity behavior when that is asked for. But of course, for patients with COPD, not only a healthy, active lifestyle is important, but there are more elements that are important in their self-management. So we created the COCO program, in which the activity coach was part of. It was an eHealth supported self-management program that consisted of 4 elements. So first of all, the activity coach to help the patient guide in a healthy, active behavior. The second one is a teleconsultation, so it was possible to have contact with the healthcare professional if there were, for example, certain questions. There was the web-based exercising, so a patient could exercise at home to improve his physical condition. And the last one was a self-management treatment. And that means that each day, every day, in the beginning of that day, the person receives one question: did you have more complaints than usual in the past 24 hours? Is the answer no, then that's the only question of the day. Is the answer yes, the person receives additional questions to gain really insight in the symptoms of that patient. In the end of filling out the diary, a person receives an advice to start medication or not. This diary that was now digital was based on the existing evidence-based action plans that were developed by MST Hospital, and they are now transferred into a decision support system. From literature, we know that the majority of the eHealth applications to improve certain behavior are based on text messages. But we also know that the effects of most of these applications are mainly for the short term. So how can we make sure that also the effects are there on the long term and that people engage for a longer period of time with such digital applications? Now, one way to do that is to use embodied conversational agents. And these are more or less autonomous and intelligent software entities with an embodiment that is used to communicate with the user. They are also known as virtual coaches. And these virtual coaches is actually a technology-mediated process of engaging in coaching conversations with an individual. So here you can see several examples of virtual coaches. So it really is a more face-to-face kind of communication compared to the text messages that we are now used of. So I would like to show you an example, and that is from the MATCH study. In this study, we actually applied the virtual coach for patients with COPD and comorbidities. We monitored their symptoms by using the same diary as before, a smart inhaler, an activity sensor, and the weight scale. And the self-reporting of the symptoms in that symptom diary was linked to an automated decision support system, then launched self-management actions based on the action plan that is already evidence-based. This was offered through a portal, including a virtual coach. And we saw that the adherence to completing such daily diaries was really high, but that the advised actions that resulted were actually inadequately followed up. Also, the inhaled medication adherence was high, but inhalations were poorly performed. So, although some parts are successful, we still need to do a lot of research to see and to identify certain barriers, but also to further tailor the intervention to an individual patient. Also, we did specifically look into the virtual coach, and we learned some first insights in applying virtual coaching for patients with COPD. And the first impression of a patient remains the same during the whole study. But we also saw that it should be further improved, and we should manage the user's expectations of such a virtual coach that is not comparable to a human being. So here's an example of how it could look like. So in this case, Sylvia, who is the virtual coach, says, "Hi Bob, for today, why don't you try to do 7,000 steps?" And then you click on why 7,000 steps. And then Sylvia says, well, you need to do a little more to reach your recommended 10,000 steps each day. But why 7,000 today? Your Tuesdays are always a little low on steps, on average 64 steps. Let's try to do a little better. Can we try a little less today? I'm not feeling well. Okay, that seems fair. Shall we try 6,000? It's a deal. All right, we set your goal to 6,000 steps and I will help you achieve it. Thank you, Sylvia. So this was an example of how such a virtual coach conversation could look like. But you can also see a lot of input is needed, a lot of tailoring is needed. And that is actually what we will be doing in Resample. So in Resample, we will develop a virtual companion that is really tailored to the individual person based on his profiles. We will select the coaching domains based on the input. We will adapt the goals together with the patient, the technology and the healthcare professional, and we will provide just-in-time feedback and coaching that is not only about the current behavior, but preferably also about the predictive behavior of that individual patient. And in that way, we can provide content that is highly tailored with real-time feedback and very highly relevant coaching. So thank you for your attention, and in case there are questions or suggestions, please let me know.